telemedicine as well as telehealth. Okay, so when you talk about the telemedicines, already we know that we'll be looking for the covering of the distance. So the remote access will be enabling with that. So why we need this? So because when you talk about the metropolitan city or the city as well as the town panchayat and the rural area. So what facility they have in the metropolitan city, they will not get in the rural area. So we want to reduce this gap. That is what we are aiming for the telemedicine, because so when you have this the expertise in the metropolitan city, so the traveling this the expertise to the rural area and addressing to the people, so it comes in the lot of effort has to be put, then the cost effective method has to be adopted. So we are going for the telemedicine point of view. So what we are expecting here means when you are performing the telemedicine, so the patients will be in the rural area. I'm just taking example rural area because from connecting with the rural area to the district head hospital itself, it will come around 20 kilometers. Hard 20 kilometers will come. If the rural area which is going to connect with the metropolitan city, we will be getting as almost 100 kilometers plus. So we want to reduce this gap. So how we are going to reduce this gap to get the expertise opinion for the second consultations, or to have the guidance for the further specialty doctors and all those things. So we'll be using the technology. That is what we are looking for the telemedicine. So if you understand the telemedicine, so this we are going to use the technologies. So we are going to use the different technologies to have the remotely diagnosis. So we are going to achieve it. That's what I was saying, the rural connectivity, or the metropolitan city to the another metropolitan city. So like that. So we look for the diagnosing the informations, we look for the monitoring purpose, we look for the treating the patients. So whenever this required, so we'll be covering with the kind of medications and all those things through the channels, so the communications medium. So the first most priority is the medicine at distance. So we are going to when you are practicing the telemedicine, we are going to give the medicine at distance. That's what I was saying, as a prescriptions can be given at the distance. See to that they will be verifying, they will be consulting with the doctors with their test reports, everything. So when you talk about this, we have like the communication medium establishments we need to have when you are establishing the communications mediums and all those things. So we'll be looking about the simplest method, the use the telephone. Okay, so the telephone is one of the simplest method, we can say as a first used method also, so to perform the telemedicine technology. So we need some kind of the support from the communications end to have establishment of the telemedicine and all these things. So in the 1950s, the telemedicine is started in the United States and all this. So then they collaborated with the NASA and the US Public Health Services. So they started with the 1960s. So to give the access to the remote locations. So from there they are connected with the telemedicine system. So they provide the care to the patients and all those things. Then they started with the 1970s. They started with the teledermatology and other things for the prisoners and other things. Because so when you have this kind of establishment, so you can reach the people, so you can provide the benefits to the people. That is a very, very important. Okay, then they started with the 1986. They started with the two-way satellite programs. So you need to understand how this communication is established for the telemedicine. Okay, so similarly we have like a telehealth. So here also we will be using the technologies. So different technologies will be bringing to help the patients. So whenever it's required for them, you will be providing some kind of assistive solutions with that. So they will be looking for the very hard times like illness, all those things. So they can look for the self-care access and all those things, so that they can connect with the doctors. So they need not wait for some caretakers and all those things. So they can access through the systems. They can get the information on that. Okay, so this is what the telemedicine as well as the telehealth, the process. So when you talk about the history of telemedicine, already I told you. So it comes with the present situations. If we understand, so we have like a very good improvement in the telemedicine. So the access, the rights of the patients, everything will be improvised, as well as the cost is should be reduced. So cost also it's reduced. That is very, very important. So then only you can have the practice of telemedicine. Otherwise, no. If the why we will say example, I already told you the example that the patient wants to travel from to check the expertise opinion, they have to travel 20 kilometers, they have to travel 100 kilometers. Then they will say from the rural area or the remote locations, they will say no need to go like that. So you are not providing the benefit to the people. So that is very, very important. So when they want to travel, the cost will be increased. So they're decreasing the cost also. So how we are going to decrease the cost? What are all the facilities we are going to have? We'll see in the later stages. So when you talk about the phase of telemedicine, so we have like a pre-electronic telemedicine. So that's what I was saying, right? So the patients will be writing to the physicians and all those things. Then the patient will be getting. So that if you are understanding, the patient is calling the doctor and getting the consultations and all those things. So when you talk about this kind of informations required from the physicians, as well as the consultation from the physicians, so the patient has to approach the physicians. So when you're talking about the communications medium, so you will be having like the two communications. One is a analog communication as well as a digital communications. So then we have like a telegraphy. So that's one of the oldest method. So they used for the communication purpose in the earlier stages. Then they are using with they used for the teleradiology also. So for the whatever the images acquired in the X-rays or other things. Okay, so you need to understand. So when you have this kind of establishment with the communications mediums and other things, so the next comes with the telephone. So telestethoscope. So the doctor can access that, and they can get all the information, whatever it's required. So you can create a kind of networks, so that can be used through the internet. So we have like a network connectivity. So now you can think about the 2G, 3G, the 4G, 5G. Now we are talking about the different advancement in the network connectivity and also. So you need to understand. So now we have like a 2G and 4G. So if you understand the 5G, so the speed, the affordable cost, so this all it comes into the pictures to have the access to the internet. So similarly we have like a radio, televisions, as well as different wireless communications. Nowadays the wireless communications also, if the entire organization is connected with the wireless communications and others, to have the data interchange and others. So this is what phase of telemedicine. Now if you understand, this is the model of telemedicine. So definitely when you're looking for the telemedicine, so you will be having the two-hand connecting point. So one we can say as a nodal hospitals, another one is the referral hospital. So this nodal hospital as well as the referral hospital has to be established connections. So through the different communication medium. So like different communication mediums. So based on the availability, so if we can't expect all the rural area we have like 4G network, or we can get the 5G network like that. Okay, so you need to understand. So where is the remote site as well as the nodal site? We have referral site. We have, so the nodal and referral has to be based on the availability. So we'll be connecting with the communications medium. So when you talk about the nodal centers, so that the patient will be and the treatment. So the patient will be directly connected with the nodal hospital. So the physician, so they will be treating the patients in that locations. So here the console will be there. So the telemedicine console. So that should have the minimum the requirement of audio and as well as a video conferencing. So when you have this audio and video conferencing facilities in the nodal hospital, they'll be connecting through the communication medium to the referral hospital. So when they have connect with the referral hospital, so the patient will be in the nodal hospital. Patient is treated by the doctor physician in the nodal hospital. So whenever it's required, they will be getting the referral from the expertise from the referral hospital. So there are in the referral hospital, so there is need of the central telemedicine service unit. Okay, so this unit will have all the servers which is connected to the different nodal centers and all those things. So here also we require the communications establishment with the audio and the visuals. So this both will be nodes will be connected. So when you have this nodes are connected, so whenever it's required by the nodal physician, so immediately they will be referring, they will be establishing the connections to the referral centers. I hope everybody would have understood now. So how we are going to practice telemedicine. So when you have the nodal centers as well as the referral centers, so already I told you we need to have the audio and the visual communications units. Then the physicians will be there, then which is connected with the referral center. So when you have this, you can check here. So we in the nodal centers, we need to have the biomedical equipments. So this biomedical equipments like a ECG machine, EMG machine, EEG machines, stethoscope, everything will be there. So which is going to have the doctor patients unit will be there. Then we have like microscopes, everything, all the sophisticated biomedical equipments we need here. Okay, so which is going to access through the webcam. So this webcam will be connected to the computer. So so the patients will be visible to the referral centers through this webcam. So whenever the doctor nodal centers, they are communicating to the referral centers. So in the referral centers, so the specialized expertise will be there. So they will be connected through the computer with the communication establishments. So they will be having kind of printer and scanner, so webcams and all those. So they don't have any sophisticated equipments, biomedical equipments here. Because why? They are not required at all. Whatever the test results taken from the nodal centers, they will be sending to the referral center. So in the referral centers, the doctors will be referring the reports and they will be giving the consultation to the nodal centers. You understand? So why I'm emphasizing here on this? So you need to understand when you establishing the nodal center as well as the referral centers, you need to understand how much the involvement of the different equipments and all those things. Because the ECG machine is required in the nodal center because we are going to take the ECG of the patients. So when you have ECG machine in the nodal center is more than sufficient, which is going to give the report. Thus ECG, the rhythms and all those things, it will be printed on here. That image, the printed image, will be scanned and it will be transferred to the referral center for the analysis purpose. Okay. In the reference center, there is no need of any ECG machine, EMG machine, EEG machine. For example, I'm saying. So any sophisticated biomedical. So in the expertise, they'll be having the software which is going to give the access to the all the test reports and all this. They will be identifying, they will be analyzing the reports, then they will be giving the feedback to the what kind of procedure has to be adopted, whether they want to change the procedures or still the procedure can be continued. So they will be communicating with the nodal aspect. Okay, so this is what you need to understand. So when you are establishing the nodal centers as a reference, so it based on the requirement, you need to go with that. Okay. So when you look for the objectives of telemedicine, so definitely we need to have the clear objectives. So why we want to perform the telemedicine. So when you're performing the telemedicine, so you will be using the different kind of informations. So with that, you will be using the kind of communication mediums and different technologies adapted to provide very good telemedicine. So when you are using this information as well as communication mediums and all those things, so you will be providing the specialized healthcare consultations to the patients in the remote location, in their location. That you need to understand. It's a very important thing is in their location, remote location itself, you are giving the specialized expertise opinion, expertise consultations to them. Okay, so we facilitate through the telemedicine, so like the video conferencing medium. Through that, we'll be facilitating that two expert can be consulting for the better treatment. So that is also very important. So you need to understand the patient which is connected to the nodal center to the referral center. Okay, so to get the patient to get the expertise. The another way you can use this video conferencing methods. So the both expertise can be or more centers can be connected with that. So to interact with the expertise to have the better treatments as well as the care. That is also it's one of the objective of the telemedicine. It's not only the patient doctors relationships. It's establishing them video conferencing between the expertise. Okay, so the healthcare expertise, so that they can have the better treatment for the all the patients. So that is also very important. Similarly, you will be getting the opportunity for the continuing education also. So that's what I was saying. So one expertise can give a lot of continuing educations to the other doctors and all those things. So this healthcare professionals, so that they'll be benefiting with that. So the telemedicine will work in this way. So this is a major objective. So the relevance of telemedicine, so we need to have like the infrastructure considerations, so inadequate infrastructure. So then we need to have the like the patients the numbers. So when you look for this, you will be getting as like inpatients as well as the outpatients. So you can consider for the when they are looking for the specialized appointments and all those things. So how many numbers you can capable of handling and all those things. So when you look for this, already I told you in the very first initial stage. So experts are available in the rural areas, remote locations, very low availability. So we want to overcome this. So that is the reason we are looking for the this kind of telemedicine performance and all those performance. Okay, so the similar way to look for the training of the healthcare professionals, we can give for the say example in the from the referral centers, doctors can educate the to discuss with the rural centers doctors with that. So all the facilities can be given to the the nodal centers and different nodal centers. So this will give you kind of opportunity to get the train between all the doctors. So when you have this telemedicine, the benefits, what are the benefits to the patients? So very important thing is, so they will be accessing the very specialized healthcare services. So with the remote locations and all those things, wherever they don't have any it's a low availability of expertise, so that area can be covered with this. So the system will allow access to them to get the expertise opinion with them. Okay, so one more thing is how we are connecting with them, nodal and referral centers, which referral centers is connected with the, how many nodal centers. That's all will be the discussion. Okay, in the later stage, how they'll be they'll be experimenting and all those things we'll see. Similarly, they can have the access to the medical specialists to the large populations. So without physicians referrals or all those, the online appointments and all those things they can have. Similarly, we can have whenever the the patient is visiting the doctors, the specialty hospitals and all those things. So they need to go for the kind of long-term follow-up. So kind of elderly people and all those things. So it will be very difficult for them to travel from house to hospital and others. That time, so we can have definitely whenever it's required, they need to visit the hospital, but we can reduce the visits. So that is the ultimate aim. So they can consult from the home itself. So they can, when they are consulting from the home itself, they will get understand that whatever the prescriptions given by the doctors, so they will take from that treatments and all those things. They will go. The number of visits can be reduced whenever it's required. Definitely, they will be going to do. So, say example, they want to perform the kind of CT image or MRI image. That time it is not possible from the home or from the rural center. So they need to nodal centers. They need to go visit the hospital. Okay, but that other times they no need to visit the hospital to check with the reports and all those things. They can, with the consultation they can. You understand what I'm trying to say? So it's very, very important thing is, so what kind of benefits they have with the clinic. Definitely we'll be looking for the improved diagnosis and the treatment, also better treatment they will be getting. Okay, so everything when you're talking establishing the communications medium, so you will be looking for the everything in the digital data. So access to the computerized as well as all the data will be like a text, voice, images, everything will be of the patients will be taken care of. Yeah. So whenever the patients require, they will be identifying with the offline as well as the real-time informations they will be getting. So that is the advantage you need to understand here. So the patients also will get their data. The doctors also, they will get their patient data. That is very, very important. The no data will be missing here. Okay. So the similarly they look for the follow-up as well as follow-up things. The after the say example the patient is discharged from the hospital, so the timely follow-up can be taken. So the kind of alarm kind of thing, so the can be taken after 30 days, after 15 days. That can be, so when they want to interact with the doctors, the quick and timely follow-up can be done with that. So another important thing is benefits to the physicians. They will be looking for the continuing educations and the training through the video conferencing. Already I told you. So the doctors will be connecting with that. So when you look for the telemedicine benefits, we talked about the patients, we talked about the physicians. We need to talk about the hospital as well as the insurance benefits. So when you talk about the hospital, so the hospital also nowadays, this especially this pandemic situations, so the number of visits are reduced. Okay, the patients visits. So they'll be consulting through the video conference. Okay, so like different the tool they are using. So through that, so the doctors are connecting with the patient. So the unnecessary visits can be reduced here. So when you are looking for the unnecessary visits reduced, definitely the cost will be reduced. The travel time is reduced for the patients. Okay, so the crowd also reduced in the hospitals. So the nowadays the social distancing and other things. So this can be managed. So um, the similar way you need to think. Sometimes the if the number of visits are reduced here means.
Sir, you're not audible.
Yeah. So they will be looking about the infrastructures, what they can have with it. Okay. So when you have this kind of information, so there will be. Yeah. I'm just loading. Okay. So they will be looking about the information. So that can be taken here. So when you're looking this kind of information, so hospitals also will have all the informations. So so they'll be having the insurance company, so that is also we need to consider here. Okay, so when you are considering the insurance company, they will be sometimes they'll be restricting the access to the insurance benefits and all those things. So that is also, it's very important. Okay, just a minute. Yeah, so the early discharge can be taken. So we can have the services. We can have all the infrastructures with that. Okay, so this is what the hospital and physicians. So this is the one image I'm showing here. So the nodal centers and the referral centers with that. So you can see here which is connected through the network communications with here. Okay, so you can different part of the area will be connected. So say example, one state we are talking, so we'll be connecting with the different districts and others. The different districts will be connected to the different rural centers and others. Okay, so with this I'll stop for today class. Okay, so if you have any doubts, you can ask. Okay.